Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is October 22nd, 2025. This video is on a Journal of the American Heart Association article on oral bacteria and coronary plaques. The article was published in August and was titled Viridans streptococcal biofilm evades immune detection and contributes to inflammation and rupture of atherosclerotic plaques. Oral bacteria and coronary plaques. Bacterial DNA, particularly Viridans group streptococci, from the oral cavity is frequently found in coronary plaques, potentially contributing to inflammation and rupture. Methods. The sample size was 121 autopsies and 96 surgical patients from Finland. Follow-up duration, cross-sectional design. Demographics, adults above the age of 35, predominantly white and Finnish or from Finland. Techniques, real-time quantitative PCR, immunohistochemistry, and genome-wide expression analysis. Statistics, chi-square, Fisher extract, Kruskal-Wallis, and age-adjusted logistic regression. What did they find? They found that the oral Viridans streptococcal DNA was found in 42.1% of the autopsy plaques and 42.9% of the surgical plaques. There was a strong correlation with plaque severity, p-value of 0.0001. It was associated with coronary heart disease death, p-value equals 0.021. With myocardial infarction, p-value was 0.042. Biofilm evaded macrophage detection, but dispersed virulent streptococci triggered immune response. The limitation of the study is cross-sectional, cannot establish causality, mostly limited to the Finnish Caucasian population. The key takeaway, chronic oral biofilms may play a causal role in plaque rupture. New target for diagnostics and therapeutics, including biofilm imaging and acute phase antibiotic trials. Clinical pearls, oral Viridans streptococci may colonize coronary atheromas as immune evasive biofilms. Dispersed streptococci activate both innate toll receptor 2, CD14, NF-kappa beta, and adaptive immunity that includes CD3 and CD247. Immunopositivity correlates with increasing atherosclerosis severity and sudden cardiac death. Antibiotic failure in past trials may be due to biofilm resistance mechanisms. Dental health may be a modifiable cardiovascular risk. These are the eponyms related to the trial. TSDS is the Tampere sudden death study, from which they use autopsy-based data on unexpected cardiac deaths. The Tampere vascular study, they use surgical samples from carotid, femoral, and aortic arteries. And the other key trials are the CANTOS trial, landmark trial supporting the role of inflammation and cardiovascular risk beyond lipids. So go ahead, go to that dentist at least 3-4 times a year for oral hygiene. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.